Negotiations between the nurses union and the hospital began back in April, but they have not been able to reach a deal on a new contract. The main sticking point is the nurse-to-patient ratio. For her entire 34-year career as a nurse, Nancy Lipschutz has worked in the intensive care unit with cardiac patients. Her care can mean the difference between life and death.
Patients can be literally fine 1 minute and dead the next. That is the way it works, you know, and you have to be aware of every minute change in that patient's condition. So maybe you can prevent, but how can you prevent it and how can you pay that much attention when you're so spread thin?
That's why she and the other nurses of Robert Wood Johnson University Hospital went on strike Friday, after their union and one of New Jersey's largest hospitals failed to reach a new contract deal. The staffers say the amount of patients that each nurse is responsible for during a shift puts their patients at risk. They also want higher wages and benefits. The bargaining process has been bumpy. It started in April, and just last month, union leaders rejected a pay increase offer made by the hospital, which has now hired travel nurses. The president of the nurses union claims the travel nurses are getting more support than the staff gets.
We should be inside working, and we should not have travelers in there. Those nurses have 3, 2 patients. All we're asking is 1 to 5, 1 to 4, and they're giving them resources, they're giving them everything in there.
Last week, the hospital released a statement saying it has some of the highest staffing levels and highest paid nurses in New Jersey. The hospital's latest offer included a bonus for nurses, but they say it's not all about the money, and they expected better treatment after all of their hard work during COVID.
It's just really disheartening to see the hospital not really care for us like we cared for it when things were as bad as they were.
Nursing is a science, but it's also something that you deliver from your heart. It's not tasks. It's you come here and you give yourself to these people.
Pix 11 News reached out to Governor Phil Murphy's office to ask if he would be stepping in to help in the negotiations, but did not get a response. There are no upcoming meetings between the union and the hospital leaders for now. Union leaders say the nurses are ready to get back to work as long as they can reach a deal on safe staffing.